Hi, everybody. I'm so excited to welcome our guest, Stephanie Weiderstrand from Beyond Special. She's an amazing mother and also an advocate for children with autism. So, Stephanie, thank you so much for being here.
Hi, Linda.
Hi.
Thank you
Stephanie,
for inviting
why
me.
don't you, oh, you're welcome. Why don't you tell us a little bit about yourself?
What about myself? Um, as you said, I'm a mother. I'm a mother of three beautiful children, and we are based in Sweden. My family is actually based in Sweden. So I'm the founder of Beyond Special, where I help families raising children on the autism spectrum to find clarity, hope, and peace through simple daily actions. So that is what I do. And incidentally, I'm also the host of the upcoming Empowering Autism Summit, which you are a guest speaker in.
Yes, absolutely. And I'm honored that you invited me. It's going to be a
Oh,
magnificent summit.
the honor is mine. I'm just so happy that you actually agreed to come.
Absolutely. Stephanie, could you share a little bit about your story? Because everybody is going to be so, intrigued by you.
Um, well, for me, it's like I started this journey because of my daughter. I have a daughter who is on the autism spectrum. And since then, since we knew about her diagnosis, things have changed a lot and on the family front. And things that my expectations of how to bring up a child and everything changed. And nobody actually gave you a menu how to raise a child on the spectrum, and you're
No,
just totally clueless. I
you're
don't think
on your own.
I don't think I'm the only parent who feels that way. It's like, okay, what am I supposed to do now? And
Right.
things like that. So I went on this journey like what most parents do. It's, follow the doctor's advice or the therapist's advice. You need to put in so many hours of therapy every week, doing this, doing that. And I also remember one of the therapists saying that, early child intervention is very important, which I agree.
Yes.
However, they give you a time frame that if you can do this much of work, before she turns 6 years old, she may be better. And they even use the word cured of
Right.
autism. They use this word cured of autism. And I was just like, okay. And at that point in time, my daughter was almost 3 years old. So I had approximately 3 years to was it cure her autism, doing this, doing that, and all. And I went through this race of doing it. And I felt very frustrated. And when she had another diagnosis at 6, not only, like I said, they said that she's, they used severely on the autism spectrum. And she was also, she had mental disabilities, which I didn't really believe. Severe mental disabilities. And so intellectual disability. So all these things all came about, and it's like, no, this can't be true. You know, are you saying the last 3 years I put all that work into it came out to nothing? And you said that she's this and that. And that really got
All
me
the diagnosis just hit you, right?
just like, oh my God. So I put all this work, things. I even quit my job. And all that kind of things to become a stay-at-home mother, to help her, to be her therapist, and all that things, her teacher and all. And my work went for nothing. So it really got me very depressed, very burnt out in the process. And I didn't know what to do. So I decided it's like, I'm not going to do that for a while. I'm going to take a break from homeschooling. I'm going to take a break from all the therapies and all, because I realized that I couldn't remember a time, even though I was spending every hour with my daughter, I couldn't remember a time where I really genuinely played with her.
Yeah. I love
Uh,
that you're saying that. Go ahead.
and so I was like, okay, let's put all that aside. For weeks, for 6, 8 weeks, I just did that every single day with her, that we are going to go out and at least do something new, something different. Things like watching a movie with her, which I never dared to do. Going ice skating with her, which again, it was something, new territories, rock climbing and all that kind of things. I just wanted to just have fun, push boundaries, whatever I can. And some of the activities worked and some, didn't work, but
Mhm.
that was okay. But it was because I was just connecting with her, having fun with her. And just within a few weeks, I'm not talking about months, within that few weeks of just having fun with her, I saw change. I saw change to her, and I found a way that I could communicate with her.
A
And that
way to
was,
get in, a way to get in.
yes, a way to get in. Exactly. And she was almost minimally verbal during this time. She was minimally verbal for almost 8 years of her life. But I found a way to communicate with her, and that was through typing and spelling. And I realized the way she communicates was not the same the way she talks. And that was amazing in itself. I always say this, that if the answer is cat, but she might say dog, but she types cat. She spells cat, but she says dog. So it's like, okay, you know, I have to trust more in the way she spells more as a form of communication than actual words.
Wow.
And that has been my way of getting her to her. And then I realized that through spelling, she was actually a brilliant girl.
Huh.
She was a brilliant girl, that she knew a lot of things. And then it got me thinking, like, what did, the report say about her? And that she had, this intellectual
Severe.
disabilities and
Yep.
all, and severe. So no, this is not the case. So it really got me to rethink about the autism label, about the diagnosis and all, and how to help her. And by beginning the journey, not with all the therapies, but with the connection, having fun
Absolutely.
with her as the very first step. So that has been the start of my journey.
You touch my heart when you say that. It's so magical, and it's true. We're given pathologies, diagnosis of all different pathologies, and we're running around trying to get all the different therapies and interventions. But it starts with us and the relationship that we have with our children. That was very powerful, Stephanie,
Thank you.
and it moved you to do what you're doing today.
Yes. Since then, it really moved me to like, hey, if this is actually happening, there should be more parents should know about it. And at first, I just thought that this experience of connecting with my child alone was unique to me. But when I talk to more parents who have been on this journey for a long time, they share the same experiences too. They agree that the therapy is just a small portion of it. But if you don't start with the connection, even if you have the best therapist in the world, the best program in the world, but if you don't have that love and the connection and the acceptance,
Yes.
it's very difficult to make progress, to grow, and to thrive. Other things about I've also learned is, in order to help your child to grow and thrive, you need to help your family first. You need to help yourself first.
Help yourself first. Yeah.
Because if you don't, you're just a shell of yourself. If I'm depressed, or if I'm angry, or frustrated, or tired, I can function. And
Absolutely.
if I want to help my daughter, I have to help myself first. It's not being selfish. And
Well,
I
you
need
know the analogy. You've heard of the analogy of the mother
the,
with the child on
the
the plane?
yes, correct. That's
You know,
often
in my parent support group, I always ask them who gets the oxygen first, and everybody says the child. And people don't realize, no, you know, you have to take that oxygen to be able to refuel yourself, to be able to help your child. So self-care is so important, especially, I mean, for all parents, but especially for parents like us that have kids with um, special needs and special, you know, learning differences.
Mm. So what about you? Maybe you can share your journey too.
Oh, my journey. So I was a nurse for 25 years. I worked in a hospital and worked on psychiatry. And my husband and I decided to have start our family in a very unique way. We adopted 2 children from Russian orphanages. And we didn't want babies. In the 90s, everyone was adopting baby infants. We wanted older children. So we adopted our son, who was 5 years old, and my daughter was 4 months younger. They weren't biological siblings, and they lived in different orphanages, and they were there from the time they were infants. And we went down to Russia to, you know, to bring them home. He didn't speak Russian. He grunted, so he had no language skills. When we brought him home, he didn't sleep. He didn't for 2 weeks when we were down there. When we brought him home, he was diagnosed with ADHD, very, very hyper, severely hyper. Every learning disability that you can imagine, from dyslexia to dysnomia to he did it all. Fine in gross motor skills, central auditory processing difficulties. He was diagnosed with mild autism, Tourette's, mild intellectual handicaps, fetal alcohol, because the majority of the moms were drinking alcohol in Russia. And by the time he was 14, even though I knew it, but they didn't believe in childhood bipolar, he was finally diagnosed with bipolar. And my daughter was diagnosed with a nonverbal learning disability, attention deficit disorder, and reactive attachment disorder. Because remember, in orphanages, they had like 100 kids in the facility with 2 caregivers. So they were never able to get their needs met. And so what these kids would do when they were hungry or thirsty was they would self-soothe. And here they have this mother and father who only want to hug them and you know, be close to them. And it was like, especially for my daughter, whoa. So I knew everyone in Montreal, which is where I live. I knew everyone in Montreal, and all the psychologists and psychiatrists that I went to said to me, this is what they have, but they weren't able to give me the meat and the potato strategies on how to help me help my kids. And so I did a lot of reading and tried to join a few, you know, parent support groups, and got them into, you know, speech therapy, occupational therapy. But then I ventured down to the States and went to the CHAD conventions, the attachment conventions, the LD conventions, and autism conventions. And I walked into workshops and I had tears coming down my cheeks because they were talking about my children and they were sharing strategies. I have to share with you one workshop that I went to at an attached conference was called Theraplay. It was all play therapy. And Theraplay represents healthy child and parent attachment, and it reproduces it. And I sat there crying because I saw the therapist and the child didn't want to be hugged or touched. And within a few minutes of just doing these playful interventions, these playful activities, the child was hugging and kissing, and I couldn't wait to get home. And I tried them at home with my children. They were in my lap. They were hugging me. They were kissing me. And I said to my husband, I have to go down and I have to train. So I became a Theraplay, I was certified in Theraplay, Nurtured Heart, which is the most beautiful way to communicate with your child. It's all positive. HeartMath, which reduces anxiety and anger and social thinking skills. So I put them all together And I was able to, through all of the interventions, help my children, who today are 32 and 33 years old. So I've gone through for the, you know, the young children, the tweens, the teenagers, and young adults. But the play was the magic bullet. That joint attention that you were describing with your daughter, that joint attention, that shared playfulness with your heart, being in each other's world, the close body proximity, the touch, the soft voice, the giggles, the hugs. It's magical. And it's all about the relationship that we cultivate with our kids. Being present with them, being accepting of them, being curious about their feelings, about their reactions. It's just so important as parents. That relationship is key.
Yeah, because I always say that, you know, this journey has taught me to see my children in new eyes and changing your perspective or things, because we are so trained to see things or expect things in a certain way. And then you realize, hey, my child's not really quite like that. But, you know, when I put that aside, I put that judgment aside and things and tell myself, let's take all of that away. Take and see, how can I see her differently? As you talk about the curiosity, being curious and things like that. And I realized she's actually wonderful once I could take away all my previous perspective of things and seeing her in a new eye. So my relationship have changed with her. The way I talk to her, I describe her, I relate to her is all very different. The kind of questions that I start asking, you know, why is she behaving like that? You know, or, you know, my daughter needs help. You know, she's not causing the problem. She's feeling pain or something like that. So I am, by doing that, I'm not coming to her in a place of anger. And that has helped so much in the journey with me and her. Yeah.
That's beautiful. I like what you said. And it's true, you know, people want to try and fit your round peg in a square hole. And our kids are different. Our kids have, you know, their feelings, their interpretations. And it's so important that we understand. For instance, you know, when we look at behavior is a result of their feelings, their needs, and their wants. And also with, you know, kids that are on the autism spectrum, it's sensory issues for them. And a lot of people would say to me when my son was having a meltdown, he's so spoiled. You know, he only wants to get what he wants. But I knew that the lights were too bright. I knew that the sounds were too, you know, and I was able to pick up what was happening for him. So we have to be able to be aware of where we are with them and how they're affected by all the stimuli, that's sensory stimuli.
Maybe you could share a bit of what you are going to speak at the upcoming summit
I'd
of
love to.
the Empowering Autism Summit.
I would love to. So I'm going to be talking about fostering emotional and social skills using Theraplay and Nurtured Heart, which is what I was talking about earlier. And very, very powerful pieces to be able to use in your parenting toolbox. So it's for all parents who have kids with autism, ADHD, and learning disabilities. And I'm going to be offering a free 90-minute workshop on Saturday, May the 29th at 1 p.m. Eastern. And I am so excited to meet all the parents who are going to be joining and asking questions and learning some new tools.
finally you have a workshop that I can actually attend
Oh,
at a
that's going to be
time
fun.
because of the time zone difference.
Start again. So Stephanie,
I will be talking about how to help families improve their quality of life through simple daily actions. For me, I truly believe that we are meant to thrive and not survive in this atypical parenting family life. And I believe that even where you are on the spectrum, we can have meaningful and purposeful lives. But it's also reframing the way we think of what success is and taking simple actions every single day towards building that life we envisioned. Because I don't believe of placing limits just because the child has autism, but rather is making the challenges for them autism friendly. Very often or not, I see a lot of families, it's like, this is too difficult for you. Let's remove that. And they take it away. And the child never,
avoidance.
yeah, they never really get to try it because it's said it is too difficult, but they don't build resilience along the way.
And the parents are rescuing them.
Yes. But it's, like I said, it's not about removing, it's about making the challenges for them autism friendly, breaking it down step by step in more intuitive ways and things like that. So I help parents to build that into that with very, very simple daily actions. So maybe a task may take, say, 10 steps or 5 steps for a normal child, a typical child, but maybe it might take 10, 20, 30, but that's okay. And it's breaking it down and celebrating that little steps and victories along the way.
Absolutely.
So that is what
Absolutely.
I'm going to share. And also, I'm like you, I'm having a workshop, which is on the 26th of May. And it's also about helping families to thrive workshop. So it's going to be very hands-on, very practical workshop then as my free giveaway.
That's fabulous.
Mm.
You are such an amazing, dedicated, devoted mom. And I want to thank you for being here today. And I want to thank you for everything that you do to help everyone else out there.
Thank you so much. And you too, you're doing a marvelous job. Always a
Thank you.
pleasure to speak to you.
Thank you. You too.
You too.
Take care,
Bye.
darling. Bye. See you soon.
See you.